Hello, everyone, and welcome back from our break. I failed earlier to introduce myself. I get so excited that I'm just like, let's get going. Katrina Carter, Assistant Deputy Director of Institution Operations, covering programs and reentry for the state of Iowa. And I also am the Iowa Border Patrol liaison for DOC. So I work a lot with the Border Patrol. It is my absolute honor to introduce to you my colleague, my friend, my mentor, my everything amazing in life, Dr. Nicole Jarrett. I first met Nicole Jarrett in 2015 before she was our prestigious and well deserved, with tons of hard work, Dr. Nicole Jarrett. Nicole is with Council of State Governments and has worked with Iowa DOC on many, many projects, initiatives. We are excited to have her here with us. Her bio is in our attachments. I don't want to take away from her presentation. We have the chat feature, and Nicole and I were emailing earlier, and this can, also be a discussion, question and answer. But Nicole will be sharing the National Reentry 2030 initiative with us today. Dr. Nicole Jarrett, thank you so much for being with us and for your support of our great state.
Thank you so much, Katrina. I really appreciate it. And it's so great to be with all of you. Happy Second Chance Month. And I'm just excited to just talk about where we are as a field and where we're going, and hoping that we have some time to have some discussion. So let me first share my screen. Hold on.
And Nicole, I will keep track of the chats, so don't worry about that.
Okay, great. Hold on one second. Let me just start from the. Okay, let's get in, let's see, let's get into presenter view. How does that look? Are you guys seeing it? Oh, no, you don't want to see the presenter view. You don't want to see all that. You want to, you want to see the slideshow. Okay, great. Good to see all of you and to be here. As Katrina has mentioned, I am a senior policy advisor with the Council of State Governments Justice Center. Been with the Justice Center for over 13 years now. We're a national nonprofit, nonpartisan organization in which we collaborate with leaders across all three branches of government to improve criminal justice systems, help promote community safety, and enhance second chances. And today I want to spend some time talking about where the progress that we're making together as a country, what some existing challenges remain, talk about a new initiative that we're really excited about, and we hope Iowa joins us in because they're ripe for it. You all are ripe for it. And I want to dive in a little bit into some of the stickier issues around reentry policy and practice, and then hopefully open it up to some discussion. So not only is it Second Chance Month, we are celebrating the 15th anniversary of Second Chance funding in the field. And so it's excited to hear the shout out to a Second Chance grant that was recently received. Iowa has paved the way for the country with all its outstanding work on their statewide recidivism reduction grant that they received, you all received several years ago. I've been working with Second Chance Act grantees pretty much ever since that first cohort of grantees. And we've seen a lot of changes and growth across the field. And so, um, and so as we think about those changes, I think it's important to be thinking about where we were originally, which was everybody just kind of getting the same thing. Um, there was still a little, still a little bit of a bit of a nothing works, a little bit mentality. Second Chance Act and what states were doing, communities were doing, are really leaning into rehabilitation, really leaning into what we know works in terms of evidence-based practices and what research is saying. Often when we would go out as a technical assistance provider, we would talk heavily about evidence-based practices, which I'll spend some time talking about again here, because I think it's important to reiterate those. But we've come a long way. And it reminds me of before I joined this Justice Center, I was doing a postdoc fellow with Rutgers University, and we were visiting all 14 prisons in New Jersey. And it was part of the PREA study. And during the tour, at the beginning of the study, this one facility, this gentleman, Mr. Howard, who was running um, I, it's a bit of the kind of like a tech program. As we were walking from one building to the next outside, a young man, he looked like maybe he was 19 years old, who was incarcerated. He stopped and greeted us, and Mr. Howard explained that we were with Rutgers University. And after a brief chit chat, the young man was saying his farewell, and he said, take care of them, they're our future. And Mr. Howard shot back, so are you. And I'll never forget that, because that's something that you all who work directly with people who are in the process of returning probably have at your forefront. But I definitely hope that more and more people have at the forefront. It reminds me of the quote from Helen Keller, which is, a bend in the road is not the end of the road. This young man's future was not going to end there at that particular facility. And so one of the things that we get to do, especially you all, is to be able to help be part of their story, of being able to make that bend in the road. And so I want to talk about what success has looked like. And so we have seen states showing significant statewide drops in recidivism. And we capture that in multiple ways, from rearrest, from reincarceration, revocation. Some of these are double-digit drops. This is from a report from 2017. We're going to be releasing a new report I think today or sometime this month, an updated report on statewide recidivism reduction. That's just really encouraging. Iowa is part of this success story. 3 years, in 3 years consecutively, you will see this drop from this high of 39.6 in 2020 to now 34.3. And that doesn't just happen. That takes a lot of intentional effort. And this recidivism drop is a mix of it's a mix of no new crimes, but then also people not returning on revocation. And something that we've been highlighting in more recent years is just how important it is to focus in on revocation. We know that 45% of state prison admissions are due to violations of probation or parole for new offenses or technical violations. A quarter of all state prison admissions are due to technical violations, such as missing appointments and with supervision officers are failing drug tests. So as we think about the drivers of recidivism, and meaning a return to prison as one key metric, we need to also be thinking about how we can invest in successful supervision. We know this is extremely costly. We looking at data from 41 states, estimated that $8 billion are spent to incarcerate people who have who are on supervision violations and revocations. Iowa is one of those states that you all have better data than other states and able to share that. And the put a little arrow there that's 103 over $103 million. That's what that cost is there. Nationally, we see some good news in terms of probation and parole. From its peak, we see the numbers coming down. And then you also see on the right-hand side a chart looking at the share of the probation population by most serious offense and how that's changed over time. And you see some equal measures where you're looking at 2020 around drug, property, and violent crime. But one thing that you'll note is that the violent crime percentage widening to more recent times, and that impacts who's on supervision and responses. We see something very similar on parole as well. So I talked a little bit about us as a country spending more time and focusing more and leveraging what we know works according to research. And this is the National Institute of Corrections came up with, identified 9 principles of effective intervention. It's used very heavily in corrections, these particular 9, particularly targeted towards community supervision. But I will say, I think there's elements of this that is useful for all the pieces, organizations and groups that are working to improve reentry outcomes, that are trying to that are working directly with people who are returning, helping to set programs and thinking about how to ensure that their programs are best situated and their practices are best situated to see the best outcomes possible. So this in and of itself can be an hour presentation. I'm going to just spend some time just quickly going through these 9. But I will say, if your organization is like, we could use a brush up on this at the Council of State Governments Justice Center, you can feel free to reach out to me, and we're happy to spend an hour or 2 hours with you talking specifically about this. So when we're talking about core correctional practices, a big part of still today is risk, need, responsivity. Hopefully that doesn't feel like a too new term to you, but this is where we think about those who are at higher risk. That's what risk means, higher risk of reoffending. Criminogenic needs are those risk factors that are dynamic, not so something like the age of first arrest is not a dynamic risk factor, but things around attitudes and perceptions and peer supports, those are dynamic factors that are associated with a person's risk of offending. And the idea is that we're going to be targeting our interventions to address an individual specific criminogenic needs. The treatment intervention works best when it's responsive or tailored to individual learning styles, motivations, abilities, and strengths. And I will say that when R&R, risk need responsivity, came out, a lot of people didn't spend a lot of time thinking about responsivity. It's like, we got to put this program in and didn't really spend time thinking about responsivity. So I would just say, like, if you have an intervention, how are you thinking about being responsive to someone's learning styles, motivations, abilities, their strengths? The goal is to encourage long-term behavior change. We need to be able to use techniques that access internal motivation for change rather than those that rely solely on external pressures. although that's not a guarantee, realizing that motivation can change over time and it can be very specific to a specific type of behavior. So you can have a person who is motivated to participate in family counseling, motivated to pay a particular fee because they see maybe they see hope in being able to reconnect with a spouse or with their children, but perhaps they may not be motivated to participate in a substance abuse treatment program evaluation because maybe they failed previously in the past, and they don't think something's going to change, or they may not see that they have a particular problem. So motivation needs to be targeted to a particular area. Also, the other piece to be mindful of is that it's interactive, and so you can help increase somebody's motivation. And there's a lot of information about that. And I'm spending a little bit extra time on this because it's just one of those things that there's an increased attention to how important motivation is with studies out there. There's a study that looking at 14 different states that showed what people who on supervision convicted of serious and violent offenses and they found that praise from a supervision officer significantly reduced rates of substance abuse and criminal reoffending. And so this is something that is not geared towards that particular case manager that's really good with people. We're seeing agencies and organizations across the country saying like, okay, how are we training towards this? How are we tracking to make sure that people are doing the things that we know that increase intrinsic motivation? Um, uh, we know that we need to be thinking about quality of staff training, focusing on impact. There are things that we used to think intuitively made a lot of sense, and we put those programs in place. And now we know that they actually increase recidivism. And so the work that we are doing, we want to really invest in things that have an evidence base. And if they don't have an evidence base, they were collecting data to be able to track whether or not those programs are being effective. We know that punishment alone is not effective to improve behavior. It can stop behavior, but doesn't replace it with appropriate behavior. And so how do you reinforce the desired behaviors? And that could be things that we see in community-based correctional settings, could be specific praise and feedback on performance, indirect praise, group recognition. So there's science around this, graduation ceremonies and certificates, extending curfew, less frequent meetings with staff, less check-ins, assisting, creating rooms to assist a group facilitator or act as a mentor. We're seeing more and more programs looking at creating peer mentorship or creating alumni program for people who've graduated from a program to come back. People who are going through the reentry process really want to hear from people who have gone through the same exact process. Badges or ribbons, other certificates, getting a job in a special setting, gift certificates, all of those things are things that can reinforce positive behavior. Thinking about pro-social supports for people in community upon reentry, from collaborative, comprehensive case plans, which I'll talk a little bit about later, in-reach community-based treatment providers and having established relationships, relapse prevention, having a relapse prevention plan, the use of peer recovery supports, again, engagement in supportive family and friends. There's a lot of movement towards working with mentors, but sometimes you may want to think about working with natural mentors. As an uncle, that's part of a natural mentor that you can infuse with some training so they can show up uh, in this person's life who's returning in a different way with the tools that they need to be supportive. So thinking about also not just corrections, but employment, education, housing, treatment providers, uh, you thinking about them as resources, part of the solution, but then also infusing what we know works to enhance motivation and change behavior for people with specific criminogenic needs. And of course, measuring outcomes and providing feedback. It's an ongoing, continuous loop. Uh, as we think about these evidence-based practices, cultivating change has been a big movement in the field as well. Iowa has really been at the forefront of some of that work. So, for example, around workforce development, making sure you're hiring, retaining staff that understand the goals around rehabilitation, preparing people for reentry. What you have to the right is a screenshot of a tool that we adapted from Iowa DOC. They shared with us a tool that they use, and we wanted to be able to share this matrix for other agencies that are looking to ways to concretely encourage the types of behavior, the training behaviors and skill sets that they want in their workforce. Action research, being nimble enough to test out new ideas, try it, evaluate, pivot as necessary, having data-informed case planning. So are people hitting their goals? Is it being effective? Are the case plans being developed in conjunction and partnership with people who are returning? Continuous quality improvement. All of those things have been part of what we see as this positive momentum change in the space of reentry. However, we all know it's not mission complete in any form. Everyone that we know working in reentry, and I'm sure you all agree that there's still room to improve and that there's a lot of challenges that exist. So what are some of these challenges? One is just it's kind of like the inefficiencies. Uh, you know, there are things that I think a lay person would think happens in reentry doesn't happen in reentry, things that we would consider foundational in reentry. So we know that your reentry process looks different from state to state. It looks different from what facility you're coming out of. It can look different from what community you're returning to. There's a lot of moving pieces when it comes to reentry. The other piece is that um, sometimes you have systems not talking to one another. And so you can have behind the wall preparing people, DOCs, corrections, preparing people for reentries with employment skill training. And then you may have people, job developers and employment service providers and community preparing people doing resume building, but they don't know exactly what's happening behind the walls to help with that type of preparation. Or even community-based organizations providing the same services, targeting the same population, having the same eligibility requirements and saying if a person doesn't get a job over here and they move to this other agency over here, they have to start all over again in a way that feels like in a way that we're not coordinating and not leveraging one another. And so um, that is just something that we've been hearing over and over again. We've seen it. There's gaps in the system. So a lot of resources going to one area, perhaps not another. So thinking about how to improve that. And barriers, we just heard a really fantastic presentation around barriers around employment. There's these structural barriers, even occupational licensing. We know that occupational licensing is those for like over 40% of jobs in the US require some form of license. Those jobs also tend to be more higher paying jobs. And so there's a lot of regulations out there about who has access to what types of jobs. It can be confusing to figure those out. So I'm glad to hear about the in-state resources available. And then I will say there's a national inventory of collateral consequences of conviction as a resource that we help manage and update, as well as a clean slate clearinghouse in which you can see what needs to happen state by state to address barriers. And then there's some inequities. And so we know that where you see racial disparities, whether it's housing or employment or treatment, we have to be aware that those disparities may be exacerbated for the population that we're working directly with. And so this is a look at racial disparities in community supervision across the country, and that we're seeing a reduction across the country, which is good news. Still, we see that it's Black people are 3 times more likely to be on supervision, probation specifically. Parole specifically. So there's still room to grow, but it's positive to see those trends. And this slide should look familiar to you because it was highlighted earlier. And so in Iowa, we see racial disparities in prison and jail, police stops, and also pretrial detention. So what does this all mean? I think anybody who works in reentry, by default, you're a hopeful person, right? So we think about where we need to be in terms of reentry. Of course, we want to scale up the good things that work and remove barriers. But we want to do that in such a way that it's human-centered, that the stakeholders that are driving policy or guiding the design of the reentry system that we need to be in place. So they're at the table, we're keeping them in mind, and that could that could come about and be realized in many different ways. It could be having people with lived experience being hired in leadership, and thinking about how to make things easier for people. So making sure people have state IDs when they leave, things like that. So designing reentry systems with the end user in mind. Being more coordinated, so cross-system leadership, corrections, housing, employment, health. So less silos and working together. Being more equitable, really diving in and looking what the data says about the drivers of any disparities, and having that help inform your solutions and drive investments. And also being transparent, being clear about the direction that you're going, what your goals are, sharing your metrics, reporting out regularly on that progress. And Iowa stands out in many ways, but especially on the data front. You can go to Iowa DOC's website and see recidivism numbers and a whole bunch of different types of data. There is things that we have a problem being able to answer specifically as a country when it comes to reentry. So, for example, how many more people what percentage of people are employed 3 months post-release? We have a hard time answering that question. How many people are in safe and stable housing, within 30 days of release? How many people are find themselves in getting in the emergency room 4 months post-release. These are things that are just critical to reentry, yet we don't have a lot of good information about that. And so one of the things that we're hoping in terms of the future of reentry and being transparent and being data informed is that we're going to be expanding our definition about what reentry success means. I spent a lot of time in the beginning of the presentation on recidivism because that really still is our core metric of reentry success. But we're hoping that with a shared table with multiple systems at the table, that we'll have a better understanding of reentry success. So for example, if we have employment data, not just how many people are employed, but let's say in what industry, if we can say, well, corrections, you're doing a lot of training in this area, in this industry, pre-release. And guess what? People are actually being able to maintain or getting employed and are able to maintain employment in that industry 6 months, 8 months, 9 months down the road, or only half the people are sticking with that industry. Maybe we need to do a better match, early on. So we're still really struggling in the area of data, but I think with this intentional effort, we'll be in a much better place moving forward in the future. So what is Reentry 2030? So Reentry 2030 is a national initiative in which we're calling on states to set bold goals and achieve transformative outcomes for people who are exiting prison and on supervision. And we have a number of goals. One is 60,000 fewer people admitted to prison from supervision each year until 2030. Eliminating racial disparities in recidivism and identifying and addressing racial disparities in other reentry outcomes. Increasing the number of people employed after release, expanding the number of people accessing behavioral health treatment, increasing the number of people in safe and stable housing. These are our national goals. The way that we get there is by working on states who are setting their own goals, their own population-based goals that they've set as priorities and going to be working towards. So, for example, in North Carolina, one of the first states that launched in 2024, Governor Roy Cooper announced that they would be moving forward with a whole government approach to improving reentry services. Missouri, which was actually they actually launched this last April, they focused in on employment. They wanted to make sure that everybody who was incarcerated, who needed career services, received them. 85% of people who were formerly incarcerated would be employed within 30 days of release, and 80% would maintain employment for at least 9 months after release. These are bold goals, and on that stage, in that top picture, is the state cabinet, and each cabinet member stood up and shared what they would be doing in pursuit of that goal. And they've been meeting ever since then and have identified some low-hanging fruit and targets since then and working towards them. And so that was a fantastic event. Nebraska recently launched as well and identified that they wanted to increase their reentry success rate by 15%, increase GED completion by 30%, 100% enrollment in Medicaid for those who are eligible, 100% making sure that people get state IDs and birth certificates prior to release, and providing support to at least 90% of individuals who are released to be gainfully employed within 30 days of parole placement. Again, these are big, big goals. The name of their initiative, they're part of Reentry 2030, but they have this larger initiative called Transform Nebraska. So we're working with them as they chart their path forward. Now I would just want to spend some time on just want to lift up some things that we find to be really helpful. And one concrete way that cross collaboration can happen is through collaborative case planning. One of the things that we noticed several years ago, working across the country, communities across the countries, those grantees, and I've worked with hundreds of grantees, you could almost tell from the get-go which grantees were going to be more successful than others. And one of the things that always stood out was those grantees that worked collaboratively on case planning. And in this example, you see the community supervision agency as the lead case planner. It does not have to be that way. And in fact, if you go on our website, you'll see different models of what this could look like. But the idea is that you're working collaboratively on how to help this population move forward. And then being able to work collaboratively around identifying issues early and addressing them. And so often we'll say, when you're doing evidence-based practicing and risk need responsivity and case management, if something's not working, you'll tweak it. But often what we'll see is that the options to tweak and adjust are limited. Those options expand when you start working more collaboratively with different partners. And so I just wanted to lift this up as just a really helpful tool. Next thing I wanted to talk about is this idea of measuring reentry success. Everyone who's worked in reentry, I think there's universal agreement that recidivism reduction alone is not a great measure of reintegration success. There's so much that happens for successful reentry. So if you're, and then these are just some examples. So if you look at employment, you could be looking at what percentage of people are employed by a certain, it could be 3 months post-release, 6 months post-release, identifying what that measure is, how long they sustain that employment, how many hours per week. Are you looking at half-time employment? Do they need to be employed 40 hours per week? What industry that they're employed? One trend that we're seeing more and more in the field is that we're the ABCs of employment. Hopefully you've heard about that. We're moving as a field from any job to a better job to career. Some people have even said ABCD, the dream job. I often leave the D off because that feels like a whole other conversation, but like ABC. And so when you start thinking about these career jobs, what are some of, are there barriers there? Um, uh, Looking at wages, of course. Then you can be looking at, for example, vocational training and what I was going to, and how many are enrolled and how many complete, and then, how many people are employed in the industry that they're employed in. Uh, those are just some examples. Health, you could be looking at enrollment in Medicaid or or some other type of health insurance, enrollment in other types of benefits like SNAP, looking at participation in substance abuse treatment, and if they participated in the level that's considered satisfactory, you have to figure out what that measure is. Some places are tracking overdose deaths. We know there's a critical period when someone returns in which overdose deaths is really spikes within those first few weeks, months when someone is released. Some places are looking at, we want to know how successful we are at reversing an overdose or preventing an overdose. I mentioned emergency care use, looking at all types of morbidity and mortality. Medicaid has really great data if you're able to have that type of partnership to help you understand, and it gives you and you need to be, health is a key part of being successful in reentry. So we spend a lot of times thinking about behavioral health, but even broader from infectious diseases to also chronic diseases can also impact um, reentry. Housing can be looking at the type of housing, how long you're staying in the housing, looking at length of homelessness, and at what point do you distinguish chronic homelessness? What percentage you be thinking specifically, what percentage are actually released into homelessness? And we're seeing more and more places saying we're not going to release anybody into homelessness. At the same time, you don't want to necessarily keep people incarcerated for longer than they're supposed to be incarcerated. So these are just a few measures just to be thinking about. How are you in your area of your work measuring success? I want to spend some time talking about racial disparities. Um, One thing my background is public health, and one thing I've appreciated coming from public health to the criminal justice space is this desire to lean in and problem solve. And I feel like people who work in the reentry space are problem solvers. And so I would say that sometimes when we start talking about something that I've noticed is sometimes when we start talking about uh, racial disparities, sometimes our problem solving skills become a little bit more diminished. And so I would just say lean into all those good problem solving skills that that you have, and try to understand what is driving the problem, and sometimes really understanding what the problem is. And even though there was a slide put up earlier and there was a report that was done, it gives you a little bit of information, but there's still what that slide should have done is just created a whole bunch of extra questions. I'm sure it has. What about this? What about that? Could it be this? And so those are the types of things that you want to be able to begin to really lay out. So let me start here. So we're going to be talking about problem solving. A nice, helpful framework, I think, is a socio-ecological framework. It's used in multiple areas of social science to understand problems, and it's also really helpful to understand areas of also solutions. And so there could be a problem, and there may be a disparity that you may witness in, for example, people, maybe you're referring people to an employment program, but people are not showing up. Or they're not being successful. Identify where there are disparities. And then sometimes understanding is it something that's happening with the individual? Is there something happening in their direct, immediate environment? This is why I started saying safe and stable housing. A lot of times we'll hear from people who are returning that the housing that they're placed in is not safe housing. Maybe it's their family members that is either a strength or a deterrent in their reentry process. Maybe it's their peers. We already know that's an issue. Is it something happening in an institution? I'll give you an example. One time I was talking with uh, it was a supervision agency, and they were talking about referring people it was a behavioral health treatment program. And someone was noticing, they didn't have a lot of data, but anecdotally, that there seemed to be a racial disparity in which Black people were not completing, and they said we're being kicked out of group at this one organization. And they're like, we don't want to refer people there. But is that a policy issue, or is it one individual? What are the challenges there? What's happening there? There can be community factors. One of the things what we're seeing more and more um, in in the reentry space is this attention to how well we are equipping community-based organizations to serve this population. Um, so we talk about preparing individuals, but are we preparing community to receive individuals? And then what does that look like? We talked about a little bit about natural supports. We talked about community organizations. Maybe it's state contracts. What does that look like? And then broader policies, we talked about policy barriers. Are we um, around employment and fair chance licensing and are people who are being referred, do they think that they don't have a chance to really be employed in this area? Is the immediate need more important than a longer term employment training solution? What is it? And that's just one example of just kind of the layering. And not every single problem, I'm just giving some examples of walking through it. Not every single disparity hits all the different areas. I'm just saying this is just a way of thinking about, and you may say and the challenge could be the individual, but then the solution could be the interpersonal, right? The challenge could be the individual, but then the solution may be like, we need to be thinking about how to equip the person in their network a little bit differently to help increase internal motivation, for example. So hopefully that's helpful. I could spend an hour just on this. And I just wanted to spend a little bit of time talking about data and identifying drivers of disparities. And you'll probably be a little frustrating that you don't have data to answer all the questions that you have. I really encourage you to just interview data. Data includes interviewing and talking to people, talking to people in community, talking to people on front line, issuing satisfaction surveys, doing discussion groups. I will tell you, has been one of my big power secrets as a TA provider. You go in and you just spend time talking to people. And people who are in this space, working this space, going through the reentry process can, have strong thoughts about what the challenges are. Now, not every, you know, then you have to take the anecdotal and then try to move it more and more to really suss out what may be happening. But that's just a really good place to start. And we've seen some places lean in on supervising, surveying people who are on supervision, having standing alumni groups. All of that can be really helpful. Also, looking again at organizational change, I will say that some of the most telling things when we start talking about disparities, it has been people who are working at agencies, working in organizations that say, we have a problem here. And so I would just encourage you that if you're in an organization that really struggles talking about what the issues are that you may be facing in your organization, it's helpful to identify how to overcome that, overcome that. And I'm telling you, intent is great, but not sometimes, we need to also be thinking about the outcomes. Not sometimes, we need to be thinking about outcomes. So sometimes when we start talking about racial disparities, for instance, we spend a lot of time thinking about intent. And I would just encourage you to be thinking about impact and outcomes. Not to say attitudes aren't important, they are important, but impact and outcomes.
Nicole, we have about 11 minutes left.
Okay.
And I do have one question I want to make sure that I get to in the chat, but just wanted to give you a wave.
Awesome. Well, I am going to, 11 minutes. I really do want to get to questions and discussion. and I think you guys will have access to the slides. And one thing, and I'm so grateful to be here, and I just want to lift up, if you wanted to talk to us further about evidence-based practices, racial disparities, organizational culture change, all of that. You have a lot of internal resources in the state, but we're also happy to talk with you one-on-one or with a group. So just feel free to reach out. But I do wanna, this was really I have some discussion questions, but what I'd wanna do is, I'm gonna stop sharing. What I wanna do is hear from you all and see what you have to say and what questions you have.
Mhm. Um, Another one of my favorite people in the world, and a person I consider a great teacher and mentor, Mary Roach, is our Director of Restorative Justice and Victim Services in DOC. And Mary's question is anyone measuring victim reparation or restitution as part of success?
Mm. I think it's great that you mentioned that because I know this has come up with our Reentry 2030 states as they're planning, and I see the head nod. Iowa wants to capture it, which I think is fantastic. And and I don't think it's captured in a way that we want it to be captured. I think we have a long way to go. And so I'm glad that has been brought up. I think glad that has been brought up because that is really critical. I think it's critical in terms of uh, in multiple areas. And so I'm glad that, and I don't know if you want to say more towards that, but I think that's important for us to do that.
I don't want to take away from Dr. Jarrett's presentation or your questions for her, but please know that Iowa's Reentry 2030 initiative is in the works. One of the things that we did want to make sure we included was survivors of crime, victims of crime. How does reentry affect them in a positive light? How can we do even better for those victims and survivors of crime? So we invited Mary to be with us, but we will keep this group in the know as we make progress. We are hoping, fingers crossed, for a public launch of Iowa's Reentry 2030 initiative, summer, possibly late summer. So keep your eyes and ears uh, peeled and posted, maybe. But please let Dr. Jarrett know any other questions you have.
Yeah. I would say, let me see if I haven't been looking at the chat, but I will just say that I think we're thinking about Iowa has so many good things moving. And so thinking about what are the stumbling blocks, how can we make it easier? So Reach 2030 is a public health approach to reentry. What do we mean by public health? Public health is in other words a population-based approach, health approach to reentry versus a medical care model, in which you're just talking about one person. And the idea is that we're going to bend as a system. We're going to, instead of having the individual like navigate around us, we're going to navigate around them. The other piece is we're going to be data driven. It's also part of being a public health approach. Often you'll hear in terms of public health, you'll hear social disparity. I mean, what do you call it? Social disparities, social determinants of health. The good news is in the criminal justice reentry space, it's all social. In the health space, we say social determinants to distinguish between biological and genetic determinants of health, which are pain in the butt to crack. Yeah, not to say social is easy, but it is easier. So when in an area of like, let's say there's a disparities around Black women and with Black women and breast cancer. Black women have higher mortality when it comes to breast cancer. Now, when it's about going early detection sooner, that feels a little bit easier than Black women having a more aggressive form of breast cancer. That's a harder thing. And so that's why you really want to distinguish between social determinants versus biological and genetic determinants of
Mhm.
health. You don't have to worry about that in the reentry space. It's all social. So, but why the buzzword around social determinants of reentry? It's because we know that housing and employment and education, all those things that are important for your health are also the same things are important for people being successfully reintegrated in community. But I will say, and as much as I say, like, we need to work hard, cross collaboratively, a lot of the way I speak, and I think I'm not the only one guilty of this, is it's still very correction centered. It's all correction centered. But the truth of the matter is, housing is not just a means towards successful reentry. It is a core outcome, and if you're in the housing system, a job is not just a means towards successful reentry. It's a core outcome to the Department of Labor. So when we start reframing what success means, I think our system partners show up, our corrections, our systems partners show up in a different way because they're seeing their measure of success. I will say, as a public health person, I would say, like, no, recidivism is not an outcome measure that I am moved by. But if you tell me somebody's dying, if you tell somebody is overdosing, you're telling me somebody is having a chronic disease, that those are things that are important. You tell me somebody's uninsured, those are measures that have been ingrained in me as being really important. Those are the drivers for the things that are important to me. And so it's how we speak and how we want people to show up, and making sure we have these shared goals are just really important.
Mhm.
Okay, one of the barriers, Social Security reinstated something.
Mhm.
Mm-hmm.
And Monica, I will say that the state of Iowa has an MOU with Social Security. Um, and I put my email in the chat earlier, but we can talk about that. Nicole, there was a question from Zach. How will Reentry 2030 impact nonprofit reentry organizations? Is it specific to each state program?
Mm. We Each state will design it the way they want, but to me, reentry is local, right? People are returning to communities and working directly with community-based organizations and service providers. And so um, it can feel a bit it can feel a bit top down the way it's presented. But one thing that I do think is really important is that sometimes, and this is something that we saw with SCA, we're giving funding to community-based organizations, but we're not doing the things like making sure that people have IDs and making sure that people are getting their Social Security benefits. Like no, 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 no. Like, right? We got to create an environment in which community-based organizations can focus in on the work that they're doing. And so we believe in a big tent approach. It would be a big tent approach, and people have different parts of this, and you got to work collaboratively together. And so even if you think about that comprehensive case planning, you have agencies, but also service providers, community-based organizations. I think we need to be thinking about community differently. I think that's part of the future of reentry, thinking about how we're preparing community to receive people who have a lot of needs.
Mm-hmm.
How, really hopeful. A lot of people have a lot of hope. There's some people that don't, may have a lot of hope, maybe iffy about motivation in a few areas. How do we meet them in that space of hope? And that cannot just be state agencies. That's every single person is part of this broader solution. And
Mm-hmm.
so I've had very promising conversations with the folks in Iowa, Katrina and team. And so I think community is going to be a big part of it. I know we're at time. I got to see
Yeah.
the other presenters end early,
Yeah.
but I will just leave you with this. You're doing a phenomenal job. Folks in Iowa, you all, in many ways, are leading, and there's some areas that you can improve upon.
Mhm.
But with the good problem solving and innovation and risk taking that you've been taking of late, this is not new, taking of late, you'll be able to achieve what you want to achieve. And so I'm a big fan. I'm always rooting for the work that you all are doing. If you ever want to talk to us, I hope you can see us as a resource. The Council of State Governments Justice Center, we also run the National Reentry Resource Center funded by SCA. So you really can reach out to me and,
Mhm.
and thank you so much for having me. Thank you for celebrating Second Chance Month. Happy 15-year anniversary.